this works.
There we
Yay!
go.
Okay. I was like, I
All
wonder if we
right.
try it again. Hi.
Yeah, I was able to see and hear you, but it wasn't letting me in for some reason. I don't
Okay.
know.
Yay. We did it. Yay.
All right. Hi.
Thank you. Hi.
How are
Thank you
you?
so much for having
So,
me.
sorry, I know this was a lot of work to get this going and get our
It's fine.
schedules synced up, but it worked.
It worked. We're here. I'm so excited. I've been wanting to talk to you forever. So thank you for taking this time.
Sure.
It means a lot.
How are you feeling?
Amazing.
Right?
Like,
How long out are you?
I just went to my 4 week checkup yesterday. And so I like got my green light to start kind of living my life a little bit more the same, like to work out again and stuff like that. But I am blown away at how good I feel at 4 weeks. Like in my brain, I had like prepared myself to probably take like 6 months before I'd feel better. And I feel like my relief from so many of my symptoms was like instant, which is mind blowing.
It's funny because not everybody, but a lot of my patients, because I see everyone back morning after surgery,
Oh, wow.
and they all remark in some way, shape, or fashion that they feel better almost immediately. I mean,
Yeah.
it's funny. You know, Amanda and I have talked to some other surgeons across the country who were taking pictures before and after pictures of their eyes, not
Yes.
of their breasts necessarily, just
Yeah.
to see the visual difference in terms of their complexion and
Yeah.
of the tissue around the eye, which is interesting. And I don't know if that's just post-operative swelling the day after surgery, but people definitely notice a difference
Yeah.
almost immediately. I think the number one thing that people say is just I mean, I never had breast implants, but every patient that I've ever seen with breast implants describe just the sensation, the pressure sensation, the tightness of having them,
Yeah.
even if the capsules are normal and there's no capsular contracture, just the tightness. And that once everything's removed, they feel like they can finally take a deep breath again. That's probably number one. Number two would probably be, the brain fogginess
Yeah.
clearing up. Like
Yeah.
it's just starting to clear up, even the day after surgery, which is bizarre to me, but very interesting.
Yeah. No, I just love that you're a surgeon that listens because it was really hard for me. I'm in Oregon. And when I first started this journey, I was like, I will fly to Beverly Hills. Like, I will go anywhere to have like a surgeon acknowledge that there could be, a substantial relief when you get them out. And so many surgeons were like, yeah, I think that's just whatever. Like, I think people just think that. And the surgeon I ended up going to was like, I believe in breast implant illness. Like, I hear you, I feel you, I've seen a difference. Like,
Yeah.
let's do this.
Well, I mean, we surgeons go into this profession. I'm talking very generally to help
Yeah.
people. I mean, that's the whole thing. And I wouldn't have a practice were it not for my patients. So I think my practice, even before breast implant illness was even a thing, my practice is always based on patients. I mean, you have to talk to the patients, you have to listen to the patients, you have to then figure out a diagnosis and see if you can help them, and no matter what it is. I'm not, plastic surgeons, we do a lot of different things. Breast is just a small component of that. But listening to the patients and hearing their stories, I mean, that goes back to day one of taking a history and physical in medical school. You have to listen to the story and put the pieces together. And that's what I end up doing every time someone comes to my office, which now is many times a day for each of my clinics.
Yeah.
And it was years ago that I started piecing together that there was just too many patients with the same story who had no connection to one another, who had no secondary gain, who had no reason to remove their breast implants. It wasn't like they were destitute and looking for free surgery. It was just like it was just too much of a coincidence to not notice it and to not listen to it. And as I started seeing more and more of these patients and seeing that they get better, it just sort of reconfirmed that to me.
That's amazing. So what is your, like, you are doing a lot of explants now. What's your thought on what breast implants will look like in the future? Like, do you think more people are going to be prone to either not getting breast implants at all now that all this stuff has come out with the FDA, or do you think that's even going to change anything?
That's a great question that I don't have an answer to. I really don't know. I mean, there have been in the last, um, 20 years since the 80s, all different kind of permutations and variations of breast implants. There have been a lot of advances in breast implants. There have been a lot
Yeah.
of, uh, you know, changes in terms of the cohesiveness in the silicone gel. I was involved 10 plus years ago in the, not in the development of, but in the FDA trial of Ideal implant, which is a structured saline implant, which as it goes in the saline implant world I think is a superior device just in terms of how it looks, how it performs, etc. Um, the interesting thing about BII is that it's not implant specific.
Yeah.
That's what I see. That's what many other surgeons see, even ones who have published on this so far.
Okay.
I mean, there has been described, this sort of silicone syndrome that people thought was related to silicone implants, but I'm seeing
Yeah.
BII in patients with saline implants.
Okay.
Now,
That's huge.
so, and I've seen it with just about every implant and every implant type that I'm aware of. But in terms of, I'm not a chemist or an engineer. I don't make implants. I'm not really privy to the exact processes that the different implant companies use. But I do know that the shell of the implant is a silicone elastomer, right? It's like a chemical compound. That's what makes it a solid silicone. So there is silicone. There are other things that are used in the process of making the implant. I I don't know enough about the biochemistry of the shell to know exactly what it is. But what I presume is happening is that women who are experiencing symptoms, because it's not everybody,
Yeah.
there's a lot of them. I see a lot of them. I know other surgeons see a lot of them. They are, I think they're just reacting to having a foreign body, right? Now, every human being that has any sort of foreign body implanted, whether it be a breast implant, a pacemaker,
Yeah.
a nerve stimulator, whatever, the body's natural reaction is to wall that off. It says, hey, your immune system says, hey, this is a foreign invader. It shouldn't be here, right?
Yeah.
And it forms the specialized scar tissue, what we call a capsule around it, and that happens with pacemakers and nerve stimulators too. I mean, because
Okay.
I've done cases like that where you go in to move a stimulator, or you got to cover it because there's not enough tissue coverage, and there's a capsule there, and even when the capsules are totally normal visually, grossly to the eye, patients can have symptoms, and right now there's no way to predict who's going to have it and who's not going to have it. There's no way to predict um, when that, if you are going to have it, when that's going to be, in terms of like
Yeah.
how long after implantation. I've had patients who presented almost immediately after having their implants put in, or at least historically they would come in and say, yeah, I kind of started having symptoms a month after surgery.
Yeah.
And I've had patients who had implants in for 10, 15, 20 years without any symptoms and then started developing it. So I don't know what the trigger is. And that's why this really needs to be investigated, which is what is starting to happen.
Yeah. Well, and I
So,
appreciate you being a part of that process, because I feel like anybody that has breast implant illness that has been to a surgeon, that the surgeon's like, nah, that's not really real. Like it's just in your head. It's so frustrating.
Right. So yeah, I hear that all the time.
Yeah.
Not just from plastic surgeons, not just from patients about plastic surgeons, I should say,
Yes.
but also from their primary care doctors, their internal
Yeah.
medicine,
Yeah.
cardiologists, neurologists. I mean, I'm usually, by the time patients end up in my office and I'm talking to them, they usually have been through everything, right? They've been to their internist, they've been to a specialist for this, that, and the other, whether it be a rheumatologist, a cardiologist, a neurologist, a hematologist. Like everything, I see the full spectrum of them, and not always, but most of the time, the workup is completely negative. I mean, I can give you an example after example of like things that like all the lab work is normal, all the imaging is normal. A lot of times people think that they're not feeling well, that they have cancer, um,
Yeah.
and then they come in and invariably they'll say, yeah, my doctors think I'm nuts. In fact, they told me that they think I'm crazy because they've done everything that they can to try to elucidate some sort of reason for it, and that nothing turns up. And as a physician, that is a frustrating thing. It's a very frustrating thing to have a patient that you can't figure out what's going on with them. And so, I mean, I don't know if it's just a knee-jerk reaction to say, well, if I can't figure out what's going on with them, there must be nothing going on, so it's in their head, right? This
Yeah.
is
Yeah.
this is a phenomenon that sort of led to, I think historically, led to the diagnosis of fibromyalgia. When I was going through medical training, fibromyalgia was kind of like what we call a dustbin diagnosis, right? It's like you ruled out every other potential thing that could be going wrong, and they still feel like chronically tired and pain and just very non-specific stuff. And well, they must have fibromyalgia. Um, so so, and I think that BII kind of parallels that a little bit, just in terms of how it's being presenting and diagnosing, because the symptoms that one can have are varied. They basically can hit any different organ system. So whether it's your nerves, your heart, your lungs, your kidneys, your skin, your hair, like all these different systems can potentially be affected. And my kind of working diagnosis, even though I don't have proof of this, is that there's some sort of immunological reaction. It's the only thing in my mind that sort of makes sense for everything, that
Yeah.
your immune system is just sort of willy-nilly attacking different things. That doesn't necessarily translate into an autoimmune phenomenon, because that's a very specific type of immune reaction. Although there are patients who present with autoimmune phenomena who think that it's related to their BII, things like Hashimoto's disease, Sjogren's syndrome, um, scleroderma. These are things that have been kind of looked at historically as relates primarily to silicone implants, but again, I'm seeing it with every type of implant. So
Yeah.
I think it may just relate to a reaction to having that implant in your body.
Yeah. That's so good to hear because I feel like the questions I got were, is it because you have saline? And I didn't have saline. I had gummy bear, like a teardrop gummy bear one. And I only
Right.
had mine in like 3.5 years. And I started having issues around month 6. And I was like, it can't be my breast implants because I researched and researched. And these were the safest ones to get at the time in my brain over what I researched.
Right.
And then I started researching more, and I was like, oh, these are like the worst ones to have in certain countries or certain practices. Like, they don't even offer gummy bears. And like, it's just amazing to me how much stuff changed in 3 years. Like, by the time I
Yeah.
started researching BII, I was like, oh my gosh.
Well,
Um,
yeah, I mean, there's so it's kind of two different issues,
yeah.
and that people very commonly confuse, right? So you have BII, and which is breast implant illness, and then you have BIALCL, which is breast implant associated lymphoma. Okay,
Yeah.
which is a lymphoma is a disorder of your lymph system, right? It's a cancer of the lymph system.
Yeah.
So and there are other types of like cutaneous lymphomas that existed separate from implant. I mean, having nothing to do with it, right? So this was something that came up as relates to textured implants, not silicone or saline, just the texturing on the surface, the outer surface of the implant. I happen to now sit for the second year on the ALCL subcommittee in our society, so I'm kind of privy to updated data. We just actually had a phone call on Monday because our national meeting starts today in Atlanta. So in preparation for that, and it seems that it's really related to the texturing, and this is not private data. This is stuff that's been published in the literature. There's lots of studies about ALCL and just the number of cases, because it's been going on the cases started trickling in, I don't know, roughly 10 years ago. And it's almost exclusively associated with textured implants, and a large portion of that was Allergan's BioCell textured implants, which is the reason that 2.5 years ago they were removed from market, right? So can no longer put them in. It wasn't a recall in the sense of, oh my God, this is, the sky is falling, take them out now or else. It was just surgeons can no longer use them, and so they were pulled from the market. Now there still are other textured implants out there that are still being used, although I think if you polled plastic surgeons, probably a lot less frequently, partially because surgeons are concerned about it, partially because patients are concerned about it, right? So, and it's a very reasonable thing to be concerned about, even though the risk, if I'm being perfectly honest, is extraordinarily low.
Oh, that's interesting. So I didn't even know mine had texture to them until I had them removed and I held them in my hand and I was like, oh, mine have a texture aspect to them. And before I got them, I had no idea any of that. Which I think a lot of people don't. You research a surgery as much as you possibly can. And I really was very worried about the risks of getting implants in the first place, but I was too scared of getting scars to get a lift. I had breastfed 4 kids, and I was like, gosh, what's my best option? Aesthetically is what I was thinking in my head. Right. And now I'm just like, oh my gosh. I would have saved so much time and money if I just would have been like, I guess, scars aren't that scary.
Yeah, they're not. And, but I understand that a lot of people are risk averse. A lot of people are scar averse. And I do breast lifts all day, every day. That's kind of like my bread and butter in my practice. It was before breast implant illness, and it's even more so now because so many people, when we go and explant them, are just have everything. The skin is stretched out. Sometimes the chest wall is scalloped, so they have it. Just the breast can look not only saggy but a little bit indented. And if you don't do a breast lift, there's no one single person in this world that needs a breast lift, right? It's not a necessary thing; it's an aesthetic thing. But I've always said that, women come in for breast augmentation surgery because they want their breasts to look pretty, they want to feel self-confident, and so if you're removing them, I would say that still is true for most people.
Yes.
Maybe not everyone. Some people are like, I don't care anymore. I had my kids, I'm married, I don't really care, my husband doesn't care. But I would say the overwhelming majority are still concerned about it. I have breast implant illness patients in their 20s, right? And which is you look at someone who's 24 years old who was otherwise perfectly healthy, and why do they have this kind of debilitating chronic illness? And then you take them out and they suddenly are feeling fine. I can think of 10 women at the top of my head that have in the last year that have that fall into that category in the kind of the 20 to 30 range, who were otherwise healthy and now they're fine.
I can't hear you. Are you still there? Yeah. That's really interesting because I
Can you
do
hear?
feel like it's, yeah, I can hear you. Um, so when my
Okay.
doctor put mine in, he did tell me I could leave them in for the rest of my life, which now I'm like, why would someone say that?
Right. Well,
Um,
that's not the case. I mean,
yeah,
that's a case for some people, but that's certainly not the case across the board.
yeah,
Um, the push has been and should be toward, you know, a better informed consent process, which is what happened yesterday with the FDA, right? The FDA had this huge, if you haven't heard on the news, they released updated recommendations for implant companies and for plastic surgeons. The bulk of that being driven by a need for a better informed consent process, right? Um, I mean, I would say, it would be ideal if you didn't have to do informed consent for people, just in
yeah,
terms of an efficiency standpoint, right?
yeah,
Not in terms of a right or wrong standpoint. Um, it's good for the business of implants. It's good for the business of surgery because it cuts down on time and it saves money, and right, and everything is about the bottom line when you're in business. But it's not the right thing for patients. And, patients, whether it's a breast augmentation surgery or any procedure, informed consent is not only uh, necessary, but it's super important. I mean, like, you need to know what the risks are. And, I always have been focused on that. I always have, since I've been in practice, been very clear with patients. And I've always been adamant that, like, informed consent is not about a signature on the line. Informed consent is a process. It's a conversation between the physician and the patient, so that they understand what's going on, right? I mean, it's it's sort of our burden, if you will, to do that. Our job when patients come in is not just to be like, okay, you get this, you get that, but it's to have a discussion and say, okay, we can do this, we can do that,
yeah,
but here's what can go wrong if it goes wrong.
yeah,
And I mean, plastic surgery is a great profession, but it's surgery. It's real surgery. People tend to forget that, and there are real dangerous things that can happen. I mean, people have
yeah,
died from plastic surgery. Now, that's usually because either they're so sick that they shouldn't have been having it, or because the surgeon was maybe not using their best judgment and doing too much or the wrong things, but
yeah,
it can happen. I mean, people bleed, people get blood clots, people get pulmonary emboli, people get
yeah,
infections, people get nerve injuries. This is real stuff because it's surgery. And
yeah,
the only surgeons that don't have complications, like, from time to time, are ones that don't operate.
yeah,
So so, I think I'm pretty thorough with my informed consent process, and that has changed recently. Um, but I hear from a lot of patients that either their surgeon didn't do a good job, or they thought that they didn't do a good job. Now, I've also heard from patients, oh, well, he did this, this, and this, and he never talked to me about it. He never consented for it,
yeah,
et cetera, et cetera. And then you go back and look at the paperwork, and yeah, they signed a consent for it.
yeah,
A surgeon nowadays would have to be kind of mindless to do something without a written consent for it. So,
yeah,
and I just think it's, the problem is that our society as a whole is very litigious, right? Um, People love to either sue or threaten to sue, and so
yeah,
we as physicians have been kind of forced from a legal standpoint to have all this paperwork, and
yeah,
so, and it gets to be overwhelming. And, people come in for their pre-op and they have 40 pages to read through,
yeah,
and some people read through every line and check everything, and some people just like, where do I sign, and sign the
yeah,
bottom. So
yeah,
um but I would say, whether the former or the latter happens, it's still our obligation to say, these are kind of the important things that you need to know.
Do you feel like that protects you as a surgeon more? Like having a consent that's more thorough, saying like, hey, these are your risks. And so if you did surgery on them and someone came back and was like, I'm having breast implant illness, whatever. And it's like, well, we went over this before surgery.
Yeah.
Like, do you
Well,
remember
yeah,
this conversation?
yeah, yes, I guess it does, because you can read the warning label on cigarettes and say, oh, you can get lung cancer and emphysema and this, that, and the
Yes.
other, and still decide to smoke, and then you get it. You can't be upset with Marlboro, right? So,
Yeah.
so yeah, I mean, in a sense, it does, but that's not the reason to do it. The reason to do it is to inform patients. I mean, it's the majority of my patients are kind of young moms. They have families, they have lives, they have jobs, and
Yeah.
everything needs to be done as safely as possible.
Yeah. Yeah. No, my son, I was going through the process of like thinking of getting explanted or explanting. And then my son was diagnosed with cancer in May. And I had just read like the night before the stuff about the BC, I'm not going to say it right, but the BCAA, whatever. And I was like, just the correlation alone of reading that and then dealing with a child with cancer, I was like, there is no way I'm going to take this risk and like keep these in. Like, like, that was my dotted line. I was like, I'm done. Like, they need to come out.
Right.
I don't want to risk it. Like, it doesn't even matter if I'm not relieved of symptoms. What if, keeping these in my body leads to something like that someday? Like, I'm done. But I know everyone has their own process and their own journey, and some women have them all their lives and never have an issue. And I'm like, when I started sharing this journey, I was like, this is not a journey to shame anyone with implants. Like, you have them. They're like treating your body well. Keep those, embrace those. Like, I'm happy for you. I just want to just help share like knowledge of things that could happen, because these are things I couldn't find when I was researching myself, and I wish I would.
Well, it may not. How long ago did you have your implants placed?
About 4 years ago.
Oh, yeah. It was
so not
it was
that long ago. I just must have
not
been
that long ago, but it was kind of the term BII was just kind of being bandied about around that.
Okay.
So
yeah, I didn't find anything about it on the internet. I don't feel like. And I waited I waited till my youngest was 6 and breastfed 4 kids. And I was like, I really thought I went through a nasty divorce and like, was like, okay, I can't get them at this time. Like, I want to be healthy. And so I waited a long time and felt like I had done enough research. But, now that I'm in this world of breast implant illness awareness, I'm like, whoa, there's just story after story after story of just that affirmation that like, I'm not alone.
Right.
And when I have people that message me, I'm like, there's a world of women going through the same thing. I promise, like, you're not alone, and it is okay to be a little terrified or whatever of the process, but it's also not that scary.
Well, it's surgery is intimidating for a lot of people, no matter what it is. I mean, I've had surgery myself. It's intimidating. It's scary. There's the unknown, and especially as a surgeon, like to have someone operate on you, you lose control. It's like there's a lot of. If you're a control freak, like having surgery is a very difficult thing.
Yeah, I can only imagine.
So, yeah, I mean, there are. I'm not privy to the groups and everything that you're part of, but I do hear about it from my patients. The thing about breast implant illness is that support is amazing for people, which is part of the reason that we have our breast team and Amanda and the other members who are there and can speak from a place of a different place of experience, right? I mean, I can speak from the surgical aspect. They can speak from the other things, because there's a lot that goes into this whole process, right? It's not just like come in, have surgery, you're done, you're cured, and move on. There are other things that some people go through in terms of detoxification, and some people with psychotherapy, and some people with medical tattooing, and there are a lot of things to consider, temporally, right? Not just now, but you got to think sort of 5-10 years in the future. So yeah, so those support groups are helpful, I think, for people. I always caution, though, that because I do also know that there's a lot of misinformation that
Oh,
is being circulating around. I mean, I've always believed you can't believe everything that you read and hear. And so for any patients who are watching now or potential patients, like, I think you need to sort of take everything with a grain of salt, including what I'm saying. I mean, I'm just one guy. I'm a surgeon. I have my perspective on it. A lot of people think that I'm full of it, like, well, that can't be why, it just doesn't make sense. I mean, there are a lot of plastic surgeons especially, but also other specialists who are like, you know, I'm sure they've never said it to me, but I'm sure they think that I'm crazy for even kind of, getting involved and taking care of these patients, because they think it's like a ghost, like it doesn't really exist.
Yeah. Well, we appreciate you as patients and a patient that finally found a surgeon that listened. I know that people dealing with that, once you finally find someone that's like, actually, like, I've heard this before, or like, I want to help you, and these are the steps to do that. I think that's so important, and I'm sure you're so appreciated by so many people just by acknowledging it.
I hope so.
I'm sure.
I hope so. I mean, I think our whole team is helping a lot of women.
Yeah. Yeah.
And again, I mean, whether it's this or reconstructive surgery or rhinoplasty or liposuction, whatever the case is, I mean, that's our goal at the end of the day. My goal at the end of the day is no different than any other plastic surgeon or any other surgeon, is to help someone with whatever it is, whether it's cosmetic or reconstructive. So, I mean, that's just what I'm doing, is trying to help people the best I can.
Well, I appreciate it. Is there anything else that I should address? I've been waiting to talk to you for so long, and my brain is like, I had so many questions.
I don't know. Talk away.
I feel like, as far as like women that I think the biggest question I get is with the implant is, if I get an explant, do I need a lift? And you kind of addressed that. I feel like you said some people need it, some people don't. I personally got a lift, and I'm so happy with those results.
Right.
But also, I had larger breasts in high school, and so like I had bigger breasts and small breasts. Like, I went back and forth between sizes and breastfeeding multiple times, and so I'm like, I don't know, like, maybe if you were a smaller size and you didn't go so big, like, maybe it would be fine if you just got them out, or you could potentially just get a lift later if you're not happy with it.
I mean, prior to, and still, but prior to the kind of the increase in all these breast implant illness patients that I'm seeing, a big portion of my practice has always been revision breast surgery. That's just kind of my niche. I was a general surgeon before I was a plastic surgeon, and I've done breast surgery for a long time. So, I like it, and that's just what I've done. So, what I had seen even prior to this is it's very common that a patient will go into a plastic surgeon's office requesting a breast augmentation. Oftentimes they've had several kids and may or may not have breastfeed, but even if you don't breastfeed, right? I mean, your breasts still change during pregnancy. Yeah. So, a lot of women will say, even though they may go into a surgeon's office and outright need a breast lift because everything's hanging south, and either they talk to them about it and they don't want the scars, and so the surgeon was like, well, I don't want to lose this case, so I'm like, how about a breast implant? It'll lift everything up. And sometimes it does minimally, but most of the time it doesn't. And so then now they have a breast implant and they still need a breast lift. And then, maybe they didn't even want a breast implant in the first place. I mean, I can't tell you how many times I've heard that story. So, and to add fuel to the fire, in order to make everything fill up even more, they think if I put a small implant in, it'll lift it up a little bit. So if I put a bigger implant in, it's going to lift it up even more, which maybe like in the operating on the table that works, but in reality, as soon as the patient stands up, everything changes, right? So, and what that does is that just makes it even more difficult to
Yeah.
fix later, because it just sort of destroys your tissue.
Well, I was the client that went in and said I just wanted to lift, decided not to do the lift. I only had 165 cc's to try to fill that area. He's like, this is
Right.
the smallest implant I've ever done. And for
That's
sure,
small.
by year 3, I was like, these are sagging. Like these are like weighing me down. And so I feel so much relief just having that lift. As far as like weight on my chest, because it always felt like something was just like hanging off of me. And it definitely didn't feel perky. It felt kind of droopy after at least a year. And
Right,
those
and
were
then
kind of,
you have your implants up where they're supposed to be, and you have your
yeah,
breasts kind of hanging off where
yeah.
it's not supposed to be.
Yeah, I was
So
like becoming self-conscious with my bra off, and I was like, well, this is ridiculous. Like, wasn't this the point like of getting these in the first place? And so I felt like I'm all about the lift. Now I'm like, this is the best. Another question I've gotten a ton of questions on is, did I have a fat transfer? My doctor doesn't even do that. I had researched a few things on that and wasn't, I came up with different opinions about it. And so I was like, I don't know if people are for that. I don't know what that even looks like. Or like, what are your thoughts on fat
um,
transfers?
so fat transfer is something that I've been doing for a long time,
Okay.
primarily for the face. I mean, I do a lot of it for the face,
Interesting.
but
Okay.
also for like liposuction defects that go somewhere and they took too much fat from one area, so to try to
Okay.
correct that contour. But also in conjunction with breast reconstruction. You know, breast reconstruction, especially when it's one-sided, there's a lot of asymmetries, and it's really difficult to get breast
Okay.
to look symmetric when
Yeah.
one's been removed and reconstructed and the other hasn't.
Yeah.
And people develop rippling, and there's not a lot of tissue covering if they have an implant-based reconstruction. So fat grafting has been used in conjunction with that to sort of fill in
Okay.
the cracks and crevices of a breast reconstruction. And then, you know, several years ago, there was a handful of surgeons who started doing it just for primary breast augmentation.
Yeah.
Um, and I started doing a little bit of that, but since explanting, I've been doing a lot more of that.
Okay.
I mean, the things to know is that, again, it's surgery. There's
Yeah.
potential complications. The most common being you can get like oil cysts or fat necrosis or calcifications that can look cancerous on an X-ray.
Okay.
Um, not all the fat necessarily survives. It's contingent
Okay.
on lots of factors, such as the
Okay.
quality of the fat, the quality of the place that you're putting the fat. I mean, it's not, as soon as you do liposuction and remove the fat, it's no longer living and breathing. You need to replace it and put it into a new kind of incubator so that your body grows new blood vessels into it. And so that, first of all, not all, that doesn't always work for everybody. The
Okay.
more breast tissue you have, the more space you have to put it in. So it's almost like a catch-22, because the people that need it the most often either don't have a lot of breast tissue to graft into, or simply are too thin and don't have enough fat donor on their
Make
body
it. Yeah.
to donate it to their breasts. So,
Yeah.
but some people do, and some people, have enough breast tissue that I can do a lift and make the lift look pretty good, and then maybe they have some asymmetries that we need to even
Yeah.
out with fat grafting. And so that's, I find, is kind of where it works the best. You just, whenever I'm talking to patients about it, you have to kind of keep your expectations realistic, because you're not going to, if you had a 400 cc breast implant, you can't expect that you're going to get 400 cc's of, even if you have the fat to give, you can't
Yeah.
expect that 400 cc's necessarily is going to live and survive without creating a problem, right? It's not
Exactly.
as simple as taking out the implant and filling it with fat, because that will
Yeah.
all die. So,
Yeah. Okay.
there are a lot of subtleties to it, but I
Yeah.
think it's a great procedure to do in
That's
conjunction,
awesome. Okay.
and very, I have some patients, where they don't really have much sagging, they just want a little bit more volume, and I'll do the fat grafting at the same time I do the explant.
Yeah.
And I have others that just need a lift,
Okay.
and we just do that, or they we do a lift, and then I'll bring them back maybe 3 months later to do fat
Okay.
grafting.
Awesome. Okay, that's good to know because I didn't know
Uh,
my surgeon didn't offer that. I watched a girl get it done in New York, and she did like an explant with fat transfer, and her results were amazing. But I was like, I don't know. So that's really good
yeah, no, I
information.
mean, I have some nice results, but it doesn't always. Not everyone's a great candidate for it,
Okay.
but a lot of people are. So, and if you can do it, great.
Okay. Cool. Okay, I have a client coming in like 7 minutes, so I have
All
to get
right,
off in a second.
no
But I
worries.
appreciate you taking this time, like so
Thank
much.
you.
So,
No, this was great,
um,
and it's nice to finally meet you. I know we've been back
yeah,
and forth for a while trying to make this
yeah.
work. So,
No, I really appreciate it so much. Oh, my phone keeps dying. So if I have people in my DMs, which my DMs are flooded right now with women asking about different surgeons that do explants, is there a website or anything that's set up of like,
yeah.
hey, these are doctors that I recommend that do end block, like remove the whole capsulectomy, or is
I
it
mean, I don't know that there. I mean, yes, there probably are websites, but they're not my website, and
yeah?
I don't. And there's
Okay.
also Facebook